Module 1, Connecting, Communication with Clients and Families. Periodically in this course, we will refer to a textbook titled Mosby's Canadian Textbook for the Support Worker. This will be your textbook when you complete these language courses and enter the Healthcare Aid Certificate program. In Chapter 1, the Mosby text states that the goal of support work is to provide compassionate care. Another word that refers to compassionate care is a person-centered care. This means that being concerned for the dignity, independence, preferences, privacy, and safety of clients and their families. The acronym DIPS can help you remember these principles. In this course, we are focusing on our communication with clients, residents, patients, and their family members. Just a quick explanation of the different terms that we'll be talking about, those that we work with. The term patients is commonly used in hospitals. The term residents is commonly used in long-term care as well as supportive living. The term clients is used in home care, supportive living, and sometimes in long-term care. In this course, you will hear all three terms used interchangeably. How does the way we interact with our clients and their families preserve their dignity? Respect their need for independence. Give them opportunity to express their preferences, maintain their privacy, and help them feel safe and secure. For instance, when you use an older client's title and last name, you treat them with dignity. And when you explain who you are to a client before you start a procedure, this can help them feel safe and secure. You are not a random stranger. Hello, Mrs. Johnson. I'm Kimberly, and I'm going to help you out today. If a client knows you, but maybe had their eyes closed, you might announce yourself. Good morning, Mr. Kim. It's Rosie. How are you today? When you have a client who presents as non-binary or queer, and you can ask, how would you like me to address you? Or what pronouns would you like me to use? You are helping them feel safe, treating them with dignity, and giving them the opportunity to express their preference. When we communicate with our clients, we need to understand and respect them as whole people who are coping with illnesses or disabilities. They have unique situations and needs that we need to be sensitive to. They belong to a cultural and/or religious traditions that we need to respect. They may be experiencing pain, anxiety, frustration, and have a variety of problems on their minds. This may affect how they communicate or how they interpret communication. Let's talk about verbal communication. The words and phrases that we use can affect how people interpret what we say. In this course, you will learn phrases that will help you convey compassion, empathy, and concern. Safety. Your intonation and tone can affect people's attitudes and emotional response to you. The right tone can make you sound sincere, while the wrong tone can make you sound sarcastic, uncaring, impatient, or annoyed. In this course, when language is presented, pay attention not just to the grammar, but also to the intonation that is modeled. Safety. Speak clearly and slowly. This is especially important if you know that your accent or pronunciation may make it difficult to understand you. Check to make sure that the clients have understood you. Preferences, independence. Avoid medical terms. Use simple, everyday language. Independence. Give people time to answer and respond. Preferences. Don't pretend you understand someone when you didn't. Dignity. Use humor. Humor can reduce tension, build connections, but it is important to know when to use humor as well. Safety. Can you hear the dips here? Now, let's talk about how we communicate non-verbally. Silence can convey a variety of messages. It can convey rejection, fear, disagreement, or lack of interest. So doing procedures to a patient in silence can be upsetting and disconcerting for that patient. But when someone is sad or upset, silence can also show respect and empathy. And it can be a way to say that you are giving them a chance to speak. How silence is interpreted can be related to your body language. Your body, eye contact, posture, what you are doing with your hands, your facial expression can convey interest and care, or lack of interest, or even disgust or revulsion. So we need to be conscious about what our bodies are doing while we are providing care and communicating. What are some good practices? Sit or squat at eye level with a client who is in a bed or wheelchair. Control bodily reactions to odors. Make eye contact. Nonverbal communication. Touch can convey warmth, comfort, trust, concern, and reassurance. Or it can infringe on someone's privacy and feelings of safety. Both your age, gender, life experience, and culture, as well as your client's age, gender, life experience, and culture, will affect how touch is perceived. What are some good practices related to touch? When using touch to communicate, restrict touch to areas of the body that are considered public, hands or shoulders. Pay attention to the client's reactions. Not everyone welcomes touch. Touch should be gentle and calm, not rushed. It's important to remember to get permission from a client when you touch their body or possessions. For instance, you might say, "Is it okay if I put a purse in the drawer here?" "I'm going to put my arm on your lower back here as we roll you over. Is that all right with you?" "Is it okay if I hold your hand?" As we continue in this module, consider how your communication, both verbally and non-verbally, can preserve your client's dignity, respect, and their need for independence. Give them the opportunity to express their preferences, maintain their privacy, and help them feel safe and secure. And here is our reference.